Hello everybody, this is Dr. Noha Polak coming to you from Union City and Bayonne, New Jersey. This is a prenatal visit, and I wanted to let you know that this is for expecting parents and parents with newborns. Progressive Pediatrics has been serving the community for more than 20 years. Myself and Dr. Teraguchi enjoy taking care of newborns as well as older children. Our practice philosophy is that we do our best to do preventive care. We do talk at every well visit about the child's development, about the growth, and we review the growth charts with you in detail. We talk about nutrition, we talk about exercise, we talk in depth about vaccines, their pluses and their possible side effects, and we advocate for and do have available all the vaccines that your children would need throughout their childhood. So our office in Union City, we are on the 3rd floor, and there's a parking lot downstairs. There's no waiting in the waiting room for newborns. During the COVID epidemic, we have no sick patients at all in our office. We're seeing all sick patients by televisit so that our office is clean and sanitized for all our well patients. When you're here, you call us from your car. We tell you to come right up. When the room is ready, you go directly into your exam room. We also have a breastfeeding room in our Union City location where you can comfortably sit and nurse the baby if you need to. Besides the practice philosophy, I would like to let you know that we need to see the baby 2 to 3 days after you leave the hospital. That visit is very, very important to be done in person because we need to make sure the baby's weight is okay, the baby is not dehydrated or jaundiced. The first few days of life are very important. So please call us and make an appointment within the first 2 to 3 days after you leave the hospital. Also, we advocate for breastfeeding. However, if you choose to give formula, that's okay too. This is not our job to dictate to you how to feed. I'd like to give you some simple things to know about breastfeeding. So if a baby goes home on breast milk only, we would like you to please try your best to feed the baby every 2 to 3 hours. That's 8 to 12 feeds in 24 hours. The baby should not sleep more than 3 hours without a feeding session because the baby can dehydrate. So each feeding session should be a minimum of 20 to 30 minutes of awake sucking time. If the baby goes onto the breast and immediately falls to sleep, that is not a feeding session, that is a sleeping session. Your baby can dehydrate like that, and we cannot have that happen. So please wake up your baby every 2 to 3 hours, tickle them, bother them, have them feed with you breast to skin of the baby so that the baby doesn't fall asleep if they're too warm, and continue to bother them until they've taken a full 20 to 30 minute feed. The other parameter I'd like you to know about is the number of urines per day is the best way to tell if the child is well hydrated. So if you have a baby and you're exclusively breastfeeding at home, the baby should make 1 urine for each day of life. So on day 3 of life, the baby should make at least 3 urine. Day 5 of life, at least 5 urine. Day 7 of life, at least 7 urines. And then 7 every day thereafter. That's the best indicator that the baby's eating well and is not dehydrated. So if you go home on day 4 of life from the hospital and the baby's only done 2 urines that day, you must call us right away, or whoever your pediatrician is. This is a very important thing to know. And what will we ask you to do? We don't know yet because it depends on the situation. We will talk through it with you, give you advice, and if need be, see the baby immediately that very same day. So in Union City and Bayonne, we do have office hours every day for newborns. Union City is open 7 days a week, so we're here Monday through Sunday. If you call us any day at 10 a.m., we will see your child that same day that you call. Make sure that you do that for us, and that goes for all newborns, please. So our phone number is 201-319-9800, and this is the Union City location. The Bayonne location is 201-437-9600, and you can get all this information on progressivepediatrics.com. Hope to see you soon and have a nice, healthy birth. Bye-bye.